fighting cancer, you're probably picturing chemo just wiping out those malignant cells, right? But what if the treatment working too well could actually trigger a brand new, life-threatening emergency? That's exactly what we're talking about today, tumor lysis syndrome. So our story kicks off with a 63-year-old woman. She was just 4 days into her first round of chemo for endometrial cancer when she ended up in the emergency room. But instead of getting better, things were taking a really sudden and very dangerous turn for the worse. And the signs were, well, they were terrifying. Her heart was absolutely racing at 132 beats per minute. She was struggling for every single breath. Her body was just completely overwhelmed. But here's the crazy part. This wasn't the cancer getting worse. This was a direct result of the treatment that was supposed to be saving her life. So yeah, this strange, paradoxical situation is really the focus of our explainer today. We're going to look at what happens when the very thing meant to cure you suddenly becomes a massive threat. So what on earth was going on inside her body? The diagnosis she received was tumor lysis syndrome, or TLS for short. Let's really break down what that means and why it's considered a true oncologic emergency. To really get our heads around TLS, we have to zoom way in, down to the microscopic level, and see what happens when chemotherapy does its job. Maybe a little too well? Okay, so here's the official textbook definition. TLS happens when a huge number of cancer cells die off all at once. They literally burst open, that's the lysis part, and they spill everything that was inside them right into your bloodstream. This picture here really shows the chaos that follows. I want you to think of it like a massive chemical spill, except it's happening inside your own veins. And the body's cleanup crew, which is mainly your kidneys, they just get totally swamped by the sheer volume of toxic junk being released so fast. And this cellular spill creates this very specific and very dangerous cocktail of 4 major metabolic problems. Your uric acid, potassium, and phosphate levels just shoot through the roof, while at the same time your calcium levels just plummet. And any one of these shifts on its own can cause serious, serious problems. But here's where it gets really scary. These imbalances kick off a dangerous domino effect. All that extra phosphate starts grabbing onto calcium, pulling it out of the blood. Meanwhile, the super high levels of uric acid form these tiny, sharp crystals. And these crystals, along with the calcium phosphate junk, literally start clogging up the filters in the kidneys. This whole cascade leads to the worst case scenarios: kidney failure, deadly heart rhythms, and seizures. So in the middle of all this chaos, how do doctors even know for sure what they're dealing with? Well, they have a very specific rulebook they follow, known as the Cairo-Bishop criteria. And these criteria are actually pretty smart. They split the diagnosis into 2 levels. First, you have laboratory TLS. That's confirmed just by blood tests, showing those key chemical levels are way off. But it becomes clinical TLS, the really bad one, when you have those lab results, plus at least one severe physical problem, like your kidney shutting down. And our patient, unfortunately, checked both boxes. You know, the best way to deal with an emergency is to see it coming, right? And doctors know to watch out for certain red flags. Patients with super fast-growing cancers, like leukemias and lymphomas, or anyone with a really large tumor, they're at the highest risk. And if you already have kidney issues or are even just a little dehydrated, that really cranks up the danger level. Okay, so the crisis is happening. The dominoes are falling. What's the game plan? How did doctors fight back and get the body's chemistry back in balance? The very first and maybe the most critical step is surprisingly simple but incredibly powerful: fluids. And I mean a lot of them. Pumping the body full of IV fluids is absolutely essential. It helps dilute all that toxic stuff in the blood and gives the kidneys the boost they desperately need to flush it all out. After hydration, doctors go after the #1 culprit in kidney damage: uric acid. And there are 2 main drugs for this, and they work in totally opposite ways. Think of allopurinol as the blocker. It stops your body from making any more uric acid. But rasburicase, that's the breaker. It doesn't prevent anything. It just gets in there and actively destroys the uric acid that's already flooding your system. So, how do they compare? Well, a major clinical trial gives us a pretty clear answer. Rasburicase, the breaker, had a success rate of 87%. Allopurinol, the blocker, came in at 66%. And trust me, in a medical emergency, that 21-point gap is huge. But here's the stat that is just mind-blowing: speed. For patients who were in crisis, rasburicase was able to get their uric acid levels back under control in an average of just 4.1 hours. Now compare that to allopurinol. On average, it took 27 hours to do the same job. When your kidneys are on the brink of failure and your heart's at risk, the difference between 4 hours and more than a full day is, well, it's everything. Which brings us right back to our 63-year-old woman in the ER. Her doctors were staring down a full-blown crisis, and they decided to go with the fast, powerful option. And these numbers, wow, they just speak for themselves. Look at this turnaround. Her uric acid was at a toxic 15 when she was admitted. Just 2 days after getting rasburicase, it had crashed down to 5.1. And her creatinine, which is a huge marker for kidney stress, was already starting to fall. That was the sign that her kidneys were starting to heal. Her timeline tells this incredible story of a crisis being stopped in its tracks. Just 2 days after they started treating the TLS, her labs were getting back to normal, her symptoms were disappearing, and she was eventually sent home stable and ready to get back to her cancer fight. And this really hammers home the most important takeaway, something the researchers themselves pointed out in her case study. It all comes down to speed. Successfully managing this is all about spotting the risk early, recognizing the signs fast, and hitting it hard with the right treatment right away. So this leaves us with a really fascinating and important question for the future. As our cancer treatments get even stronger and more effective at killing cancer cells, the risk of these powerful side effects like TLS is only going to get bigger. It seems like the next great challenge in oncology won't just be curing the cancer, but mastering the art of managing the cure itself.